President Trump could be released from the hospital as soon as Monday. Doctors announced the president's condition is improving after he experienced 2 drops in oxygen since being diagnosed with COVID-19.
Since we spoke last, the president has continued to improve. As with any illness, there are frequent ups and downs over the course, particularly when a patient is being so closely watched 24 hours a day. Over the course of his illness, the president has experienced 2 episodes of transient drops in his oxygen saturation. We debated the reasons for this and whether we'd even intervene. It was a determination of the team, based predominantly on the timeline from the initial diagnosis, that we initiate dexamethasone.
The president woke up Sunday morning at Walter Reid Medical Center in Bethesda, Maryland, for the 2nd day in a row now. He's been receiving a combination of steroids and antiviral treatments. On Sunday morning, the president's Twitter account retweeted a video showing supporters gathered outside of the hospital with the message, "Thank you so much." On Saturday evening, Chief of Staff Mark Meadows said that the president was doing extremely well. But earlier in the day, he said President Trump's vitals were seen as, quote, very concerning on Friday. The president's doctors are expressing cautious optimism about his recovery, but say he's not out of danger just yet. Skyler Henry reports from Washington on the mixed messages coming from the administration.
I came here, wasn't feeling so well. I feel much better now.
President Trump discussed his health in a video recorded inside the Walter Reid Medical Center.
So I just want to tell you that I'm starting to feel good. You don't know over the next period of a few days. I guess that's the real test. So we'll be seeing what happens over those next couple of days.
The video was posted to the president's Twitter account on Saturday evening. The White House also released photos showing Mr. Trump working in his hospital suite. Last night, Chief of Staff Mark Meadows said the president's condition had improved.
With no fever now and with him doing really well with his oxygen saturation levels, we yesterday morning we were real concerned with that. You know, he had a fever and his blood oxygen level had dropped. He's not out of the woods the next 48 hours or so. With the history of this virus, we know can be tough.
In a memo, White House physician Dr. Sean Conley said the president has made substantial progress since his COVID-19 diagnosis, adding, quote, the team remains cautiously optimistic. Dr. Conley said the president continues to receive antiviral drugs as well as an experimental blood antibody treatment. Democratic nominee Joe Biden appeared at a virtual town hall event on Saturday.
I don't want to be attacking the president. Jill and I pray for their quick and full recovery.
Biden later criticized the president for failing to procure supplies of protective equipment.
If that's not the president's responsibility, what the heck is his responsibility?
The former vice president says he will be tested for coronavirus again today. The Biden campaign says that going forward, it will release the COVID test results for both Biden and running mate Kamala Harris. Skyler Henry, CBS News, Washington.
For more on this, let's bring in CBS News correspondent Chip Reid from outside the Walter Reid Medical Center. Chip, I hear some horns honking in the background. I see those president's supporters right there. The president's doctors gave an update midday on Sunday. Tell us, first of all, the latest on his condition.
Well, let me tell you, first of all, yeah, there are about 50 people over there all lined up with Trump banners and American flags, some of them with megaphones, and we're getting a lot of people honking support. And this is in the very blue suburbs of Maryland. So it's quite a party for Donald Trump, and I think they're honking the horns because they want him to be able to hear them up there. The latest on his condition is very rosy again. The doctors have been very rosy, saying that he might be able to go home tomorrow, but at the same time, they're talking about setbacks he's had and all the treatments he's on. His oxygen has gone too low twice at this point. He's taking a fairly powerful steroid to deal with that. He's also taking an experimental drug cocktail and a 5-day remdesivir program. So, it's hard to imagine that they would send him home in the middle of all of those therapeutic treatments going on right now. But he has made very clear that he wants to go home, and in the end, it may be his decision.
Chip, how are White House officials and President Trump's doctors explaining the conflicting accounts that have come out regarding the president's condition and the timeline of his diagnosis?
Well, the timeline of the diagnosis, I think they basically have said the doctor goofed up. He got it wrong. He seemed to suggest that he was diagnosed and tested on Wednesday when it really happened very late on Thursday, and that they've tried to clear it up. But on the issue of whether he had received oxygen, which clearly Dr. Sean Conley, the president's main doctor, was evasive about yesterday, today they came out and said that they simply were trying, in Conley's own words, he said, "I was trying to reflect the upbeat attitude of the team." Other administration officials have said, look, in medicine you want to reflect confidence, but what they don't understand is that when you're facing a whole bunch of reporters who are looking for the truth, the exact truth, accurate truth, you can't really do this evasive game or they're going to be on you like a ton of bricks.
Yeah, all right. On Saturday, the White House also released 2 photos that appear to show President Trump working from the presidential suite at the hospital. In neither case is the president wearing a mask, Chip. Do we know who took these photos, and is there anything more you can tell us about them?
Well, those are in-house White House photographs, of course. Nobody in the media has been allowed up there. And they were asked about that. Dr. Conley was asked about that at the press conference, and he said, look, when the president is close to anybody, he has that mask on. But he was quite a distance away, and that was one case where they allowed him to take that mask off for just a quick moment.
All right. Chip, we were talking about those number of Trump supporters that are gathered there. I'm wondering if you can tell us anything about what you're hearing from them.
About the supporters across the street, just a lot of chants for Donald Trump. A lot of positivity. I mean, these are the true believers here. They really, I don't think there's anything that could shake them from believing in and supporting Donald Trump, and they are making their feelings known very loudly.
All right, Chip Reid, outside of Walter Reed Medical Center. Thank you.
You bet.